we'll get started with this.
All right, Kim, thank you so much. And thank you for having me today. I really appreciate it. I'm looking forward to sharing the knowledge that I have. Go ahead, next slide. So today we're going to talk about quality metrics and how you can embed those into your QAPI program, but then they also align with reporting requirements you have to do for your state. We're also going to talk about knowing your system, education, organization, not being afraid to speak up and not being afraid to ask questions. So we'll get into a little bit more depth on that. So when you guys look at this slide, you might recognize some of these acronyms, right? So these are some of the reporting requirements that I deal with in Montana for 2 different hospitals. So they might make you a little sweaty. They might make you a little nervous. You might think, oh gosh, I don't even know what that means. I've actually dealt with a few situations recently where facilities don't have a quality coordinator or a quality director, and sometimes the CEO or maybe the director of nursing, maybe even a floor nurse is trying to tackle all these reporting requirements. So it's just important to understand what reporting requirements you have for your state, and make sure that you are collecting data that you need for that mandatory reporting each month so that you're not trying to scramble at the end of the quarter or maybe at the end of the year to get it all done at once. Um, Also, you don't really want to collect data just to collect data. So we're also going to think about quality metrics that we want to develop that help to meet these requirements, these stroke, promoting interoperability, emergency department, but also areas that we need improvement on within those little different departments. So, oh, PIN. Performance Improvement Network is what PIN stands for. Thanks, Sarah. That is something that some measures that we report on in Montana. They're mostly focused on like acute care patient days, swing bed patient days, more a little bit. We refer to that as QIO in Arkansas. Okay, great. Thanks. All right, so go ahead and move on, Kim. So, I feel like all of these areas really just interlap. Like, even without looking at my PowerPoint, I kind of just wanted to jump into organization of your of your information because, but all of this stuff kind of intertwines itself. So knowing your system is really important. So luckily, which is why I agreed to work for 2 different facilities, both the facilities I work for use the same EMR system. So it's important for you to know your EMR system, know where the data is coming from, know how to find the data. If you're not the one that logs in, gets to the EMR, finds your reports, pulls your data, sorts your data in Excel, who does that if it's not you? And do they know the system really well? So it's always important to know where your data is coming from, know how to pull the data, and then also having a good relationship with your internal IT and your EMR vendor. So, I mean, sometimes we'll get some new reporting requirements. Like, for instance, we're all kind of starting up this year on those social determinants of health. Well, you got to figure out, for starters, where the clinical staff is going to chart that. And then you got to figure out how you're going to pull a report with that data. Then you got to figure out, well, where does that data go? So who do I need to report that data to? Is it the state? Is it CMS? So it's just really important to know how to get the data, how to run the report, how to narrow it down, who the data goes to. But also, we're going to move into our next topic, which I'm still not sure which order I have my slides in here because everything is so intertwined, is education. So go ahead, Kim. Great, I'm glad that was next. So, okay, let's use the social determinants of health that I was just talking about as an example. So now there's this new reporting requirement, social determinants of health. And so if I just sent out an email and said, "Hey guys, hey nurses, hey doctors, I need you guys to do this. I need you to go into this flow chart or this documentation area, and I need you to ask these 10 questions." To me, it's kind of like, oh, great, one more thing. I mean, most of us that are nurses that do quality now, we've done the floor or we keep doing the floor, filling in on the floor. And I think it's really, really, really important to know why. So if I instead explain to them, hi, CMS has developed this new reporting requirement for us to assess each of our inpatients, our clinic patients, for the social determinants of health. What they're trying to do is determine if these people have a safe place that they call home, if they have food, if they have shelter, if they have water. And that's why it's important for us to ask those questions. So, that's important for the why. A lot of the times I feel like what I've experienced being on the front end of this is just, "Hey, we need you to do this." And then it's like, well, why?" But also going along to my next bullet there, it's important to keep the staff informed. So in January, we started doing the social determinants of health for our inpatients. So then I need to go back and I need to say, hey guys, here's how we're doing. This got missed on this patient. Let's not forget that. Maybe I need to develop an admission checklist and make sure to update my checklist to include my social determinants of health that is now a new measure. So it's important to share the failure and the success. All right. Like I said, these all kind of intertwine together. I wanted to get into this earlier, but I waited patiently for my slide. So um, my calendar is just packed full. And the reasoning for that is because as I got more into this, and especially once I took on the responsibility of a second facility, it's really important to set calendar reminders. So, not just in my calendar is all the meetings I have, like today's meeting, but in my calendar is like, okay, it's April 1st. Okay, I got to run data for X, Y, and Z, and I need to update this, and I need to send out an email here to the staff, let them know how they did. Don't forget to send the meeting minutes from my coffee meeting. So, it's just really important to set yourself calendar reminders. What I do is I kind of look at, okay, at the beginning of the month, when I need to gather data for X, Y, and Z, you know, I know I probably can't do that all in one day. So don't put it all on the first, or your calendar on the first is going to be super crowded and then you're not really going to get it all done. And then you're going to move on to the second and you're going to forget about the stuff you put on the first. So I'll separate out those things. So like from the 1st through the 10th, I'll put like, okay, gather data for MMEs, gather data for emergency department transfer communication, gather data for performance improvement network, and just separate those things out with your own little individual due dates so that you're meeting the due dates that are set by your state or by CMS. Let's see. Yeah, another thing is delegate if you can. I have a lot of quality metrics right now for my CNAs, and just little things like making sure the sharp containers aren't overfull in the rooms and making sure the garbage is taken out at the end of their shift. And so then I have a daily assignment sheet where they have to sign off that they did those things, and then they turn in those assignment sheets. Well, I now have a CNA going through those assignment sheets and giving me the data that I need each month to report on those quality metrics, those metrics that we have developed internally to help improve our quality of not having full sharp containers in the room and not having full garbages at the end of your shift. So those are just some little examples for you. Oh, that's good, Jonathan. A separate calendar. Nice. I like it. Yeah, my calendar's pretty busy. That's probably a great idea. The other thing too is that you can't be afraid to speak up. So I can't count the number of times that I've run data and found errors within the EMR. like items that aren't charging correctly. Like a pharmacy item that we had a Prolia injection, which is like a $2,500 med that didn't charge. And I was like, uh-oh, gotta get a hold of somebody in the business office to fix that. So that also comes with working collaboratively with all the departments. So I think that sometimes it kind of feels like you are nitpicking people's work and you're the one who comes forward and said X, Y, and Z, I found this in the back end and I just wanted to let you know about it. And they're like always like, oh, gosh, again. But there's no way to improve if you're not speaking up. So sometimes you kind of have to be the bad guy. Let them know the errors that you find. I mean, maybe a doctor forgot to document a discharge summary. Well, that's kind of hard. Excuse me, doctor. You discharged this patient without a discharge summary. I mean, that's a regulatory requirement right there. They have to have an H&P, they have to have a discharge summary. Don't be afraid to speak up. Sometimes it can feel like you're getting backlash from the people that you're speaking up to, but that's part of your job. Go ahead, Kim. All right. Lastly, don't be afraid to ask questions. You don't have all the answers. I don't have all the answers. I love Jonathan's idea of a separate calendar. See, there we go. Networking. So I know I'm part of several groups through the state of Montana and a group with my EMR that like it's the Performance Improvement Network group where we'll reach out to each other. We'll ask each other questions like, hey, I'm looking for this policy and procedure. Does anybody have one? Or I'm getting ready to update my policy and procedure on this, or I need a competency checklist for RNs. Who's got one? And collaborate, network with each other. We don't, none of us have all the answers. Also, rely on expert help when you need it. Reach out to Kim, Helen, ask these guys some questions. I'm also part of another group for Synosure Health, and they're great. I reach out to them and ask them questions sometimes too, because these guys, they memorize these regulations and they've got, the quality stuff down. So it's also important though, like when I reach out to our EMR vendor for help, like let's just say go back to the social determinants of health example I gave earlier. Hey, I need to run a social determinants of health. Where do we document that? How do we pull the report? Don't just get the answer from them. Try to learn from it so that you know how to do it yourself next time. And then you don't have to ask for help. So I'm always like learning crazy things within our EMR system that probably most quality informatics nurses don't know how to do. I mean, I mess with the rooms and the room tables and regenerate the rooms. I mean, that seems to me it's a little bit more of an IT function, but I know how to do it because I asked and I learned. So don't be afraid to ask questions and share with each other too. It's collaboration is one of the best and probably not so used tools. I mean, it should be utilized more often and it's not. And I think that if more people did more collaboration and networking, that we'd have a lot less background work for everybody trying to reinvent the wheel. So, all right, Kim.